Hello, so my name is Deborah Lockwood from Life Changer, and today I am delighted to be able to introduce you to Professor Sabine Ernst, who is consultant cardiologist at the Royal Brompton Hospital in London and also Professor of Practice in Cardiology at Imperial College London. She specializes in catheter ablation of complex arrhythmias in both adults and children, including those with complex structural heart disease. Welcome, Sabine. Thank you so much for coming on here. Could you
Thank you, Debbie.
could you start by telling us how you think you came to be so successful as a female cardiologist?
Oh, that's a difficult question. I think when I started, it was just a starting. I signed up for training in cardiology. I wanted to become a cardiologist after having some kind of early start of a little bit of research in gastroenterology, and I had the luck to just happen by chance to get into a group of a very active electrophysiologists in Hamburg, in Germany, and I was excited. Now, my German thesis was a kind of basic science project, and I had, my gels had fallen on the floor. I had been kind of properly frustrated with the whole kind of bench work and non-clinical work, and I was so happy to find something that I was clinically able to do something with my hands, and it kind of all spoke to me. So I liked 3D anatomy, 3D mapping. I just happened to be around when the first 3D mapping systems were installed in the lab, or a couple of days later, essentially. And it just kind of all fell into place by, I guess, luck. I don't know, destiny, if you could say. And because the group was so active and I realized everyone else was writing abstracts, I thought, okay, well, I write an abstract. If that gets me the ticket to go to a conference, that's what I do. Perfect. If the guys can do it, I can definitely do it. And that's how it all started. And then I got somehow the bug. I was allowed to be a first-hand operator very early on, and just the feeling of doing an ablation procedure and then seeing the delta wave go. That was my very first ablation. Was amazing. I thought, wow, I've actually cured someone. Whoa! And that was that's how it all started. And then I got hooked. So it's fun to publish. It's fun to see your paper, and then you think, oh wow, look at that, hard work, but it paid off. So that's probably how I got into it.
Hard work, but doing something that you ended up really loving. I think that's probably the
Yeah,
important part of it.
yeah,
Love what you.
yeah, and I also was doing it with things that I liked. I'd very shortly contemplated to do a career in surgery because I like to do things with my hands, but I didn't like the attitude of the people, the shouting, the kind of, I want to say, semi-aggression that you had there. And I thought, cardiology, I loved it. I yeah, it was an intense kind of specialty. It was not dermatology where you just, do something and maybe here is another cream or something, but you have direct impact. Yeah, you need to do it right.
Mhm.
But it's very gratifying. I think that's one of the key things. And fortunately, it's nearly always successful, and we hardly ever have complications. So that's the frustration factor is not very high either. If you take care and you're careful, you can get a while, you can get around without harming people. So it's another thing, if you do something high risk, if I would have constantly issues, and complications are never nice for anyone, not for the patient for sure, but also not for the physician. If that would happen a lot, then I would also probably not do it. But I love the fact that, we can cure people.
Mhm. Yeah, very good. So you mentioned that you were lucky enough to be in with a group of people who were very productive, and that helped you to become productive. Did you have a particular mentor or group of mentors? And also, were any of them female?
I had a group of mentors, I would say. I think, of course, I need to say, first of all, my mentor was Karl-Heinz Cook. Yeah. There was no female mentor at all. Um, there was Michael Schlüter, probably Fifan Ouyang, Fifan, who took the time to sit down and explain in Chinese, English, German, mix how EP and how the slow pathway with a fast pathway would, form a re-entry in AV nodal intervention tachycardia. And then, yeah,
Did it?
Michael Schlüter, who showed me all the kind of scientific part of statistics on how to program databases and stuff like that. And Karl-Heinz, who actually trusted me with a lot of things and, made me the lead for one or the next or the other project, probably most of the time, because, once you deliver one, you get another one. Yeah. So, and I was also very much mentored how to present. And if you have this kind of close coaching at the beginning, then I think the first presentations were terrible. I really remember them very, very vivid, how awful I felt. And I remember I had a script, I dropped it on the floor. How embarrassing. I didn't dare to pick it up. And I had to kind of suddenly get to the point where I remembered what was on it and kind of carry on. So all of that was tough. And there was no female role model, really. There are very few female cardiologists in Germany. There's one maybe that I would love to mention, Ellen Hoffmann in Munich. And she was the first one who offered me to call her by their first name, which is very unusual in Germany. It's like a big hierarchical thing. But she was very kind and offered that to me, I think 10 years before anyone else, quite frankly. And she is extremely hardworking. She's now the lead for a large hospital group in Munich. Fantastic career.
Did it matter to you that there weren't female role models to follow, or were you having
I
those?
think when I started in my time, medicine was pretty male anyway. So I wasn't. I remember in Hamburg there was one single female attending, and who led the echo department. But I think that generation that was above me, typically the women, if they wanted to be in a leadership position, needed to be tough. Yeah,
Very masculine.
probably very masculine, very much kind of aggressive, and that was somehow, I don't know, it's not who shouts the loudest, that should get the say, should be getting in the leadership. So that was the kind of the situation there was. Still, at least in Germany, that hasn't changed. Now, I'm in London now for 17 years. Here, it's a bit different. I see a lot of female consultants, and the amount of women in EP have changed. I think, we're getting more and more visibility. It's, there have been presidents of ERA, of HRS, and everyone, and we're getting more and more a foot in the door. So I think, it's slowly changing. But role model that I can say that's someone that I followed. In my early career, there wasn't much to go around.
Mhm. Okay, well, and one of the reasons, of course, that there were so few women in cardiology is that there has been a perception that you can't be a successful cardiologist and have a family, but you are one of the people who has achieved lovely children. So was that something that was very challenging, or, has that just slotted?
Yeah, that's a very tricky question. I would say in the beginning, that wasn't part of my equation. I wasn't looking for a specialty that would allow family and everything. EP happened to find me in my life. I wanted to do cardiology, and EP kind of happened by sheer luck. And then in the beginning, I thought, well, there's absolutely nothing that I wouldn't be able to do. What would prevent me from doing EP? I love it. I love the fact that, you understand the anatomy, reading ECGs. I love computers. I love 3D. All of that would just be good for me. And I got sucked into this quite a bit, actually massively. And it took a long time for me to, find the right partner. I think that's a big part. Yeah, if you're so engaged in your work, it's kind of hard to find someone who understands the passion that you have for your job. And then secondly, I was so busy with research and traveling and lecturing and all of that, so it was hard. It was hard to say, okay, I really always wanted children, but it was difficult to kind of fit this all in. And I see it with a lot of my slightly younger colleagues. So I got my children only very late in my life so far. So I have a 3.5-year-old and a 1.5-year-old. But it took for me essentially the COVID pandemic, when London was flooded with patients, and basically I was asked not to come in the hospital, even not to, all operations and procedures were stopped. And I was grounded at home on my own. My husband away in Vienna for, I think 3 or 4 months, we didn't see each other. And I thought, this is not what my life was supposed to be like. That's not what I signed up for. What do I really want? I needed the time to reset and really get to my proper kind of, yeah, I don't know, motivation maybe, and the proper reasons. What do I really want? Do I need to write another circulation paper? Do I need to have another ablation, another, I don't know, another 1,000 ablations? Or how much more do I need of that? And how much do I really want? So I'm a late starter in this. But I think this has been by far the best in my entire life. My children are
You are
amazing.
back. You are back after the COVID pandemic. You've been
Yeah.
working, you continue to be innovative and productive. So,
Yeah.
that being the case, having the children was always possible, right? You just didn't
Yeah.
think about it.
Yeah. No, but after a certain age, that doesn't happen anymore by sheer luck and God's kind of will to fall pregnant. So, I had to really, dedicate and concentrate as much as I need to do, any other project that I'm doing, and just say, okay, this is the priority. I need to do that. What is needed? Yeah, it's not going to happen anymore, like so, just like that. So, but coming back, and I think that's what you're trying to get at, coming back from maternity leave twice, restarting twice, is interesting. It's an interesting experience, because I think if I would have done that during my fellowship or early on as a consultant here, I probably would have found it extremely challenging. I still find it somewhat challenging. Yeah, and some colleagues are sometimes thinking, oh, can she still do it? And I think I can. And actually, I've proven myself and to everyone else that I can. And it's like riding a bike. You know how to ride a bike. Yeah, and you can even do new things. You can do, I'm still, yeah, maybe even now after the maternity leave, I have even more ideas of what I want to do. You get more kind of in the time that you have spending at work, you try to fit in and be more efficient. So I think that's a great combination. But if I would have been early in my career, not finished and not feeling kind of fully trained, I would have been scared easier to maybe not start the same way or reduce or do something different. Yeah, because I think in general, the attitude is a bit discouraging for mothers to come back. Yeah, especially if you want to have a second child or more children. It's not so easy, yeah, to fit it all in and to fit the kind of the work time in. So
So would you actually advise people to delay having children, to anticipate that yes, they can have them, but that they ought to delay, or because you were saying it's more difficult to get pregnant
no,
when
it's quite funny. Yeah, it's quite funny, because I remember a discussion with you, Debbie, many years ago, probably 10, 15 years ago. And I remember what you told me. And in hindsight, you were right. Yeah. And now I would think I have 2 children, and if I would be 10 years younger, I probably would have 3 more. Yeah. And I regretted that I don't have more children. But 10 years ago, I would have not been able to do that. I would have not found my partner. I would have not had, this whole situation would have been completely different. So, but I think in hindsight, you can always, you're smarter, right? You know better now. Yeah. But don't leave it to kind of luck or something to happen to you. If you want something, that's what I learned in my life. If I want to achieve something, I need to work for it. It's not going to fall in just like from heaven.
make it happen. Yeah.
Make it happen. Make it happen. Yeah.
So, still on the subject of children, as you say, you were working in London when you had maternity leave, and some of
Mhm.
it was in COVID anyway.
Mhm.
But I know that you know a little bit about also maternity leave in Germany and what's
Mhm.
expected from women there. So can you just tell us a little bit about the compare and contrast the attitudes to maternity leave in England and in Germany?
Yeah. So, I don't know all the details. I know that in the NHS, which is my main employer, is pretty generous, actually. You can choose how long. So you have a right to return to your post, and you need to indicate how long you intend to stay away. I stayed away for 9 months for my first child, and then 12 months for my second.
Paid?
And that
Paid,
is paid,
paid or
and then the pay actually decreased with time. So that's kind of it's kind of stacked down. I think the first 12 weeks. I'm not entirely sure. Maybe 8 weeks you're paid fully, and then it deducts. And the longer you stay away, but you can stay. I think after 12 months you can stay away, but you're essentially not paid anymore. Yeah, but they hold your position. They cannot fill your position, or they can't end your contract when you say you want to return. So that's pretty kind of flexible. And I'm not exactly sure about the timing in Germany, but I think you have at least 12 months that you can have. And it can even be split in Germany, it's called parent time. So you can split it with your partner and you can take time off. So also the father could stay at home and spend time with the children. So that's actually pretty cool. Yeah. So I know in the US it's shocking. I have no idea how colleagues, and I'm in a WhatsApp group with some people, and they say they have returned within 4 weeks.
Mhm.
4 weeks. Wow. The baby is tiny.
So
Yeah.
the
They
difference,
haven't slept much, right? So,
the
oof.
difference though between what is allowed and what is encouraged. So the
Mhm.
difference again between England and Germany is probably that in Germany they expect you to go and be at home for a longer period of time. Is that true?
Yeah, there's this German word of Rabenmutter. Rabenmutter is a mother that, you know, leaves the children behind and goes to work and is just work concentrated and doesn't care about the family. So that is something that nearly every working mom has heard. And that's oof, yeah, the worst thing. Yeah. So on the other hand, it's kind of recognized that it actually is good for the entire family, and including the children and the mother, to have some time, especially in the early years. So they try to support the families, I think, more, and the government is actually doing this government-sponsored program. So that's where this all stems from. And I personally think this was the best time that I had. I have done a sabbatical 13 years ago, where after working in medicine for about 15 years, I had taken some time off just to try to get to a new idea. Yeah, otherwise you just run in the same direction and you never open your mind to something different. So my maternity leave, I'd taken this again as a little bit of a sabbatical. When the children are very small, they don't talk that much. You have certain duties to do and you don't sleep that much, but you have time as well to think and try to be a bit more creative and trying to, again, steer your own direction differently.
Yeah.
Otherwise, we're so driven by clinical workload. It's another procedure, another thing to do, another outpatient clinic, another patient request. You are in again, the German word is Hamsterrad, so it's the wheel with the hamster spinning. You just can't get out because the wheel is spinning you around. You need to run. You can't get off. And I think this is great. This is, again, we are very fortunate that we have that kind of reset time for us, and I think it's necessary.
So do you think that it would be good if paternity leave was more encouraged as well, so that they could do the same thing first, to have some time bonding with their children, but also to think and reset their lives?
I think so. I'm very fortunate. My partner spends a lot of time with his children, and that has given us a lot of time also to spend together. Yeah, so I'm sure Helmut would agree, maybe not fully, but I think that it's been lovely for him. I think if he would have been away all the time, and I see it once he has to travel, once in a while, he is so homesick. Yeah, latest on the second day, he said, "I want to come home." Yeah, so it's exactly, separation is not nice. No, it's great, and I think it's important to bond with the children.
Okay. So What would be your main tips on how to become successful in cardiology for those who are still early in their career, men or women?
Um, yeah, and I see a lot of junior trainees that come to work with me, and I always find, that it doesn't really matter if it's a woman or a man. Sometimes you can work with one person better. It has a personality issue rather than a gender question for me. I think first of all, you need to be excited about this. You need to catch this bug somehow, and if you do, then you'll see that really, as I described, the the sheer joy when you see you've published your paper. You get the final proofread. Yeah, and then it's published. And they send you another email saying your manuscript is now in print. And in my early years, they even send you a package with a kind of printouts, with a paper printout. So you had this whole package, and you were very proud carrying that around and giving people copies. Yeah? Nowadays, it's of course you send a PDF around. And then the next step really that excites you, and it's really cool, is if someone cites your paper.
Mhm.
Someone cites the work that you have done and say, oh, this was good, or maybe even criticizing it. At least they talk about it. That's already cool, right? So it's a little bit like nowadays on social media, where people cite it and then they say, but yeah, Ernst et al. Have published this and this and this. Well, I was immensely proud when that first happened, and I tried to get that excitement into people's, let's say, heads and hearts, to say, okay, that's what I've done. And equally, I think it's nice to see when you do clinical work to talk to these patients afterwards, see them back in clinic, have the feedback from the family. Yeah. Again, you need to be strong enough to face also if it doesn't work and the frustration. Yeah. But that's still, it's very gratifying. This interaction with people is great. We have a great job. People are typically very fearful when they come to you. Should they have a procedure on their heart? Is this really important? And then you have to talk them through the risks. And then in the end, I normally say, I have a very good feeling. I think I can sort you out. I'm pretty confident. Yeah. Sometimes I might exaggerate that with someone who's kind of very afraid. Sometimes we need to really have several meetings before they consent. Sometimes I even say the sentence, let me help you. Allow me to help you. I can sort this part of your life. And that's great. And if young colleagues see that and have the same experience, then of course publishing paper and doing trials and all of that is also nice. Yeah. But I think the clinical part is actually that it needs to start with that. And then the rest is following. And for that, you probably need a mentor, or someone who tells you how that is done technically, how to sit down. How do you structure a manuscript? How do you structure a study protocol? How do you get it off the ground? How do you get the sponsorship? How do you get, support? And you need to have that in an environment that actually supports you. If everyone is just turning you down and telling you, oh, this is impossible, So I remember, for example, in Hamburg, the saying is never, applications for grants from national bodies is a waste of time. You never get it. So I never applied for any, because all my work was industry sponsored, just because it was discouraged. I remember.
And would you encourage it? Encourage
I
people
think so.
to go to
Yes,
work?
yes. I think it's great if you have a, besides that, it looks great on your CV. I think it would be great. Yeah, it's great. Yeah, it's a lot of work. It's a lot of paperwork, probably too much, and that's why in my old group that was discouraged. But if you get the money, great. Yeah, fantastic. Yeah.
So
So
on the topic of mentors, some people are beginning to try and fit more senior people in with junior people, but what would you say is the best way to find the right mentor for you? Not you personally, but the right mentor for a particular person. How should they
yeah,
find one?
I think first of all, look around. Try attend some conferences, maybe some some national conference, and I remember being in the audience, trying to listen to the EP part or the arrhythmia parts, and then my first question was always, can I actually follow this person? Can I follow in the kind of line of thought. And I remember actually listening to Sunny Jackman, your
Mhm.
your mentor, and and Sunny is such a bright person, and I was so proud that I could follow. And I was reading his tracings, and he was saying, "Oh, look at this, and this is going this way," and I was thinking, "Great, fantastic! I got that." And it was a presentation that I followed every sentence. And there were other presentations when people presented, and I felt it completely uninspired, completely, I won't say boring. My brain had left the room. I was thinking about something completely different, which is also nice and kind of comforting, but I was not in it anymore. And that was for me to say, okay, that's someone that you don't need to listen a second time. Yeah, so you can skip that part. Right? You can skip that one. Yeah,
Mhm.
and then I could learn, how people presented, how they made it exciting or entertaining, and sometimes, so that would be for me to pick and saying, okay, I would rather have his advice. And then the question is how people interact with you. So again, I remember asking my first question after a presentation of Sunny Jackman, and I dared to put my hand up, not a native speaker, trying to phrase my question. And Sunny was nice enough, first of all, to acknowledge me, second of all, to say, oh, that is actually an interesting question. So that was the biggest compliment. I don't have really a recollection of what he really answered after that. But I was so thrilled that he thought that my question was clever, yeah, and it was worth answering it and worth not like, yeah, you didn't pay attention, sit down, I told you, right? No, he really considered it, and that was a super compliment for me. So that was kind of how I pick people that I try to follow or try to get advice from, and then some people happen to give you advice that you encounter. I remember again, Mark Josephson gave me massive amounts of advice, and that was amazing that he took the time, and that again was a great honor. And I followed his advice, and I did exactly what he did tell me. It took me a year to follow that through, but I managed. Yeah, so I think we all look for role models. You don't necessarily have to have someone who looks like you or have your gender. I think that's probably pointless, but you have to have a feeling that there's someone that wants to share something, wants to be a mentor, and has something that adds to you. Yeah, so I don't like this kind of active matching where you just have someone. There's sometimes matching programs on various conferences. I do that. I'm happy to do it, but I sometimes think that I'm not the right person. Yeah,
Mhm.
because it's not, typically we spend a half an hour or 45 minutes getting to know each other, and then afterwards, what advice do I give? I think no one actually ever came back to me after that kind of mentor round, or when you sit down on a round table and you explain a little bit what you've done, and because there's very few feedback. I think one single person actually came back, who
Mhm.
is actually very successful by now, maybe followed even a bit what I said, but yeah. So I think you need to feel, you get to know people a little bit.
Yeah, so you basically wouldn't really support this idea of pushing people together, and they do tend to put specifically, a female cardiologist with a female cardiology trainee, and that's not necessarily the best fit, is what
it
you.
it it doesn't necessarily has to work. The situation might be completely different. So um the I think when let's say 10 years ago, if someone would have paired me and asked me how to kind of balance family and training, I would have said, well, I cannot tell you because I don't have a family. It's not my situation. I cannot tell you how to go back and kind of re-enter your training, for example, because it was not, despite the fact that I was female, it just wasn't my reality. And I think in that way, we need to match people better with kind of topic wise. And some people might be, and I see a lot of very super active, super, junior successful people who don't have family and may not for another number of years or even 10, 20 years consider that. Yeah, and that's fine as well. You don't have to have a family. It's not about only this one topic. So for those, I can tell you what I've done and I would recommend it. But it's difficult, you know. And then men could be the same thing, you know. Men could have the same question, although they typically don't have to take care of the children. Yeah, they typically have someone who stays with them. So
yeah, although that may be something that is changing and that needs to change more. That
yeah.
men take a more active role in the child care.
Mhm.
So thank you for all that wonderful advice.